People are so focused on the prefixes, they're not focused on the patients. And I always tell people that a lot of times we do it wrong in our space. We do it financially, geographically, and then clinically, when in reality, it should be clinically, financially, geographically. We should put the clinical product that matches the patient first. Their ability to pay for it obviously is a very important deal. Like that is something we can't ignore. People need to keep their lights on and pay their employees.
Hello, I am B. Reeves with New Waters Recovery in Raleigh, North Carolina. Welcome to our weekly podcast, Finding New Waters. Our goal in creating Finding New Waters is to provide a resource for families to help navigate the complexities of supporting a loved one struggling with substance use or mental health. When we find ourselves in crisis due to one of these issues, most people have no idea where to turn. We hope to shed some light onto what is often the darkest hour for many families. Thank you. Good morning. Welcome to another episode of Finding New Waters. Today, our guest is Steve Donai. Steve, welcome, and tell us what you do.
Yeah, I appreciate that, B. So Steve Donai, I am founder of Growth Sherpa Consulting. Growth Sherpa Consulting is a company that works with treatment centers in all aspects of patient acquisition. Basically, what we're good at is helping patients get into treatment centers and letting them do what they do best.
I hear you. Well, Steve, I've gotten to know you over the last almost 4 years, I've been at a couple places, you've been at a couple places, played some golf together. And one thing I always wanted to ask, I've asked you before, but I want to ask you on a podcast too, is, you're not in recovery, don't need to be in recovery. What is it like working and spending so much of your time around a bunch of crazy addicts and alcoholics like me?
Well, it's been great. So I came from surgical implant sales a little over 10 years ago, and I like this environment so much more just from a personal standpoint. Back then, the MO was you go to conferences, you go to national sales meetings, and it's bar night every night, right? The tab gets thrown down and everyone just does that for the next, 6 hours, wakes up feeling terrible and starts the day over again. And you do that for 5 days. This space is so much cooler. Sure, there's a little bit of that out there, right? There's a lot of people not in recovery still doing that. But, for me to network now and to get to know people, I'm able to do that on the golf course, over coffee, cigars, just all these different ways. I think I've been to things that are like cooking classes, painting classes. It's just a unique way from the social aspect of it to get to know people better and not feel awful the next day, which is a real blessing. I think too from just from doing what I've done over the years, I love teams that are very mixed in recovery and not recovery. I've really tried to really push for that on the teams that I've led over the years, because I think it gives really cool perspective. We've seen outreach teams in this industry who maybe have nobody in recovery and it's all about revenue and all about bringing people in, heads in beds, get money. And we've seen teams that are almost all or all completely all in recovery and are too altruistic and will take everyone in, trying to save everyone at their own place and comping everyone and scholarshiping everyone. And I think that to order to run a successful treatment center, you need to have both wings on that plane. You need to make money and be altruistic. So not being in recovery, I think, helps perspective wise. And I think being around people in recovery for the last decade has just helped me be a better person, be a better dad, just be better in my day-to-day life, because, the lessons that you learn from recovery, they don't just help you there, they help everywhere. So it's been a cool journey. I think that I was put in this industry not necessarily because it's what I wanted, but it's what I needed. And I think this industry often gives you not what you want, but what you need. And so keeping that perspective in mind has made it a very blessed and fun 10 years.
Yeah, it's funny you say that. I mean, I definitely, in fifth grade, when we were talking about what we wanted to be when we grew up, I definitely didn't say I want to, work for a treatment center for drugs and alcohol, but, it's where I need to be. And I firmly believe where I'm supposed to be. And that's such a great point too, about needing both wings on the plane to fly, because some of the best advice I got was from a former podcast guest, guy Lewis Finch, when we were first opening about exactly 2 years ago, right when we were about to open. I remember because I'm actually playing in the Fellowship Hall golf outing on Friday. And that's where Lewis told me, when I asked him, what do you think, from your experience in opening a treatment center, what would you have done differently? And he said he would have given away more treatment, and that's something we took and still take very seriously. And we scholarship people on a regular basis. We try to keep it to people who are really motivated and willing. But we've all kind of, everybody in the industry seems to agree that it's usually a recipe for for disaster, without some skin in the game. But I'm so glad that we got that advice and did apply it and do apply it, because it if nothing else at the beginning, when we were brand new, we didn't have enough clients to have the staff busy and learn how to operate the place. And so it was really good advice and helped a lot in that way. And we still do it. But at the same time, we can't, if we keep giving everything away and we don't bring in enough revenue to keep the lights on, then we can't help anybody. So there's definitely a balance there.
Absolutely. And I've actually done things in the past with outreach teams to manage that, because I think as an outreach rep, most outreach reps out there probably agree, like they're not really equipped with the knowledge of what their activity actually brings in from a revenue standpoint, right? So they can bring in 10, 20, 30 admissions and think, okay, I'm going to ask for a scholarship. I'm going to ask for a scholarship here. Maybe for some people that's 5, or now I'm going to ask for a scholarship. And they don't understand, I think, how that fits into the treatment center's overall picture. And so at a previous program I worked at, I actually created a dashboard for each rep that showed real time, every little detail about their admissions and the business side of things. So how long do they stay at each level of care? How much revenue do each level of care bring? Their vertical markets, their hospitals bring in more revenue per patient than their treatment centers or their therapists. And so what it did is gave us really an ability to work with each rep independently and say, okay, hey, you aren't hitting your targets for, your revenue per day and average length of stay. Perhaps we should tone it back on the scholarships a little bit. Or other reps where we'd see, man, you're absolutely killing it. You're, 30% over your average length of stay. You have extra revenue per day. You're, obviously the business is coming in really well from here. You can go out there in the community and you can offer more scholarships. You have the ability to do that. And we were able to leverage it in the big picture and really serve more people, because we actually knew on the back end what the numbers look like. And for me, I didn't get into this line of work just to make money. I mean, I was in surgical sales before. It was definitely a different world. I got in this line of work because I think it's cool that the better we are at our jobs, the more lives we can save. And so the way I can contribute to that is providing that back end data to show reps like, hey, this is how you can maximize your impact in your communities, how you can leverage that and help the community and the treatment center. So yeah, I think scholarshiping can it can spell doom for a lot of treatment centers who just go off the rails and don't have any sort of anything in place to navigate it. But yeah, you can do smart things and still be a very successful treatment center, keep your lights on, keep your employees paid well, keep the food in the cafeteria really good, and provide, service to people who need it, who might be on a hard time or might not have the access to insurance or funds like the other patients do.
Yeah, well, we definitely have no real method to our selection process, and we don't really have any kind of process in place, because the nature of detox, it's so urgent that we can't, if somebody seems like they're motivated and a good fit and we're considering them, they don't have time to go through some lengthy, acceptance process. So, but even beyond that, maybe we should look into the more metrics driven when and who should be able to operate them. But so that's a great point. I'm glad you brought that up. But you inadvertently brought up another point that I hadn't thought about in a while. And this was, I guess, 4 years ago during COVID, summer of 2020. I was just a little over 2 years sober and was going to a meeting at a guy's house because most of the meetings weren't happening in person. And we were reading a book by a famous legendary guy in recovery, Sandy Beach, called Steps and Stories. And I was in the middle of the interview process, or had just been to an interview for what became my first job in this field, where I originally met you. And right after the interview, the first meeting I went to after that, this guy's house, we were in a chapter where we were talking about this concept called a two-hatter. And if I remember correctly, this was in the 70s when more and more treatment centers were becoming more and more prevalent across the country. And the question was, can somebody, in the certain type of 12-step recovery I'm in, is it okay for that person to also work as a professional in that field? And so I was a little nervous about it, but fortunately the answer is yes. But I absolutely, there are two things I want to say is one, I'm only speaking for myself, but I hope others agree. I treat my job, I always say I treat my job like I work at Sears. Like it's not my recovery. I keep them very separate. They can totally and often do complement each other, and I'm able to apply one to the other and vice versa. And then the other thing is, somebody needs to do these jobs. So I would rather be somebody like me, or even though you're not one of us, as we say, somebody like you, than some of the people who are in it for the wrong reasons, which is strictly revenue, and can get a little greedy sometimes.
Yeah, and funny, I did work at Sears in college, so
You
I definitely
did.
know what. Oh yeah, I sold the TVs, VCRs. Definitely dating myself, but
Was it called Sears Roebuck when you worked there? You're not that old. You're younger than I am. I know you are.
no, just Sears, just Sears. Yeah, yeah, that was, and that's a good point. That's something actually I had to learn a lot about when I got to leadership in the space was how to navigate my employees who were in recovery and make sure that their recovery was first, and that how to identify when those things weren't happening. Finding out a employee of mine would have 12 sponsees and be wanting to do work with alumni and be running BD, and it's like something's got to give at some point. And so, learning how to have the conversations of compassion and care, and making sure that I'm putting my employees first in that aspect was something didn't have to deal with at Sears, at Unifirst Uniform Rentals. Like it wasn't a dialogue you ever had. Um, but here, for sure, it's always front of mind for me, and I think that's actually helped me become a better leader over the last decade. Is knowing how to navigate that better and learning, probably from some mistakes early on in my career, but then over time getting more acclimated, more understanding, and asking better questions, and I think that was a huge help in my leadership journey.
That's really, I'm very relieved, and I'm not surprised because I know to hear you say that, but that's really cool because they teach us when in recovery, the first thing we put in front of our recovery will be the first thing we lose, or the second thing we lose after our recovery, our sobriety. And it just reminds me of in the literature, it says the more dependent we are on a higher power and program of recovery, the more independent we are as a result. And for me, that's totally true. As long as I'm not hiding out in the rooms, then but I'm actually working on my program, then I end up having more time for everything, especially work, especially sponsees, especially the stuff that I enjoy hobby wise, golf, etc. Time with the girlfriend, whatever. And but like any addict, I can abuse anything, and that can also be recovery, where I can sort of hide out in it and use that as an excuse to shirk other responsibilities.
Yeah, and it's true this too. Even for the people who aren't in recovery, doing this work, like the more connected you are to the disease state, the better you are at what you do. Brought up COVID. I'll never forget. I did an intervention, which I don't do often. For anyone who knows me out there, like maybe two, three. It hasn't been often, but I just happened to be in a place. I was in Florida for a managers meeting in height of 2020, and had a friend's friend in Clearwater who was abusing alcohol and benzos, had some disordered eating, had some other stuff going on, and after that long night, I remember going back and meeting with the leadership team and saying, "Hey, do we really know who our patient is? Like, are we really connected? To the board members, are you guys really connected? Like, we were so focused, especially during COVID, for treatment centers. I think I read a statistic that outreach admissions went down by 25% during the height of COVID. Also, I think a lot of PE firms projected an 11% decrease of treatment centers nationally that would just shut their doors because they couldn't stay open. Um, and a lot of us got so hyper focused on that, we became more disconnected from the patient. And I know that when you become that disconnected from the patient, you do behaviors in the field, or you do behaviors as an organization that end up hurting you revenue wise and hurt the patients. And it's almost counterintuitive to any other business plan I've ever been a part of. For early in my career selling TVs at Sears, you sold more TVs. That's how Sears was supposed to stay in business. They did a poor job of it and they went out of business. Um, but it wasn't as much about being a partnership with the customer. It was about driving the revenue and driving the warranties and selling the cables and selling all these other things, and you're commissioned accordingly. Here, I
Mm-hmm.
think that if you really dial in and put the customer first and walk beside them, there's no shortage of people who need help. So we shouldn't be fighting over someone just because the prefix is their policy. We should be focused on putting them in the best program for them. Um, and the true great treatment centers, I think we all know out there, do that. And guess what? They're thriving. They're not
Mm-hmm.
struggling.
Yeah, it's a great point. And to that point, we say it and mean it. We wish we could take everybody who calls us, but we can't. But we definitely help everybody who calls us, even when they, cuss us out when they find out we don't take a certain type of insurance or the cost of private pay. But we still always give them resources. And I do think that that's what separates certain treatment centers from other ones. Other ones are very interested in the prefix of a policy. You're exactly right. Tell people what that means, by the way, for people who don't know what that we're talking about.
Yeah, and it's actually it's very market driven. Not every market's like this. I've had the pleasure of doing this work in I think 33 states now. Some areas don't focus on this as much, but certain prefixes on your insurance policy pay at a higher rate, and so treatment centers are fighting for that prefix. So when someone calls in, they have XYZ, ABC, whatever prefix it is in that market that really pays. They're going to fight over that, and they're going to do everything they can to keep that person in their treatment center, whether or not they're a perfect fit for them, right?
Right.
And so I think that's where the maladaptive behaviors really come in place in outreach is that people are so focused on the prefixes, they're not focused on the patients. And I always tell people that a lot of times we do it wrong in our space. We do it, financially, geographically, and then clinically. When in reality, it should be clinically, financially, geographically. We should put the clinical product that matches a patient first. Their ability to pay for it obviously is a very important deal. Like that is something we can't ignore. People need to keep their lights on and pay their employees. And then geographically, in my opinion, it doesn't matter. If I break my leg, I'm going to the best surgeon I can find. I'm not going to the best surgeon I can find that just happens to be close to me, right? So I think that keeping that in mind for treatment centers is huge. And I know some places do it great. I mean, that's the importance of having national relationships. You get to know people all over the country that might have these little niche abilities that when you identify them on the front of that call with a patient, they call and say, "Hey, I need help." You can think, "Oh, I know this place that's in Colorado or Wyoming or California," and it might be a little frightening to the patient or their family. But if that best treatment is possible there and it's a financial meet, their financial needs are met with it. Yeah, absolutely. Let's prioritize that.
Yeah. What love your feedback on like what's a mistake that's easily avoidable for let's say a mother in crisis looking for treatment for her son when she's calling around. What do you suggest they do? What step one?
Yeah, that was one of the first things I thought was so wild about this from the consumer perspective, from the patient perspective. You don't call usually with this long plan put in place, but you're calling for something that's crisis and emergency most of the time, and then expect to spend $30,000 to $50,000. So it's like waking up one morning and then having to go buy a new car. That's stressful for
Right.
anyone, right? Like if you had that happen to you, you're like, oh my God, how am I going to do this? How am I going to navigate this? And I have to have this done right now.
Right.
Um, and then Google, of course, can be helpful, can be hurtful. It depends on how it goes from there. Every treatment center looks great online. That's one thing I've always said is if you can go to treatment and treatment centers brochures or websites, you're gonna have a great time. But of course, because that's going to be the best palm trees and the best looking things possible. So for the loved ones who are looking, I think it's finding a couple things. First, I think it's being open to nationally looking for a couple reasons. I think the first, we talked about is sometimes a better program isn't near you. That happens in a lot of markets where there are treatment vacuums and there might not be a good treatment center for a couple hundred miles. And that happens for various reasons. I think the other part of it is sometimes, and this is wildly confusing, some insurance policies just pay better in some markets than others. So, for example, if you have two $30,000 a month treatment centers, and I've seen this happen. I once had a $30,000 a month treatment center in one market take a policy from Oklahoma, and it paid $16,000 for all 30 days. And so that meant the patient had to come up with $14,000 out of their own money. That same policy went to a different market, great treatment center. It paid $6,000 the first 3 days. It would have ended up paying $60,000. The patient would have come out of pocket $0 for that. And so navigating that, I think, is incredibly complex for a patient and their family members. I sincerely feel for them because it's so confusing to know. Like, why would you know that? How would you know these things, right?
Totally.
Um, so I think the first thing is being open to a nationwide search because that gives you the best opportunity to leverage your insurance both in or out of network because there's pros and cons to that. And then I think secondly, finding a trusted advisor. There are a lot of very respectable treatment centers out there that are willing to sit down and listen to you. And usually for me, the way I train my teams is we call other treatment centers as part of training. So when I onboard new BD reps, I have them call other treatment centers out there, like a secret shopper. And the ones who ask for that insurance right off the jump, and that's the first thing they would lead with, are usually you can feel they're not going to be there walking beside you in your treatment journey. But the
Mm-hmm.
ones who get to know what you have going on, build that clinical alliance, and then find out what the insurance policy is. If I was a mother, a father, a brother in those shoes looking for a treatment center, and someone did that with me, but then they weren't a fit for my insurance or policy or whatever, maybe treatment, and they recommended a place, I would be more inclined to follow that person versus hopping back on Google and rolling the dice again. So, unfortunately, there's no super easy answer.
Yeah.
I think it's really just having to do a little exploratory digging and seeing what works best and being open to possibilities you didn't think might be there.
Yeah. I mean, I echo everything you said. That there is no magic bullet, but in that you said it really well too, that Google can be very helpful or harmful. It almost depends on exactly what your criteria is that you search, because I've seen, obviously people get directly to us, which is great when when it makes sense, and then we have people who are looking for detox in Raleigh, and next thing you know, they're on the phone with some fly by night rookery in California, trying to fly them out there and, have them sign some documents they shouldn't be signing, that type of thing. Um, I always try to just encourage people, if you have somebody, and most people don't, I certainly didn't know anybody who works in the treatment field before I got sober, as far as I knew. If you know anybody who, even if they're a therapist, if you know anybody connected at all to this world, I would recommend that they go to them. Do you think that's good advice?
Yeah, absolutely. For sure. And then I think too, I mean, I just think about your program too, B. I mean, you have someone for a week or two in detox. Your program has the unique ability to not just see the person in that crisis mode, but to really work with them and in that time to find the next place that they can go to. And I think that for my time in detox, when done right, that was really helpful to the patient. Um, of course, always the challenge. I'm sure you never see the patient who has it all figured out after 7 days.
Of course.
But but yeah, that is a unique thing. And yeah, for sure, if you know someone who works in this space, I don't know anyone who works in the space who isn't willing to put down what they're doing and help.
Absolutely.
Um, I mean, perhaps I'm not hanging out with those people is the reason why, but yeah, everyone I know drops what they're doing will help that person in need.
Absolutely. And you just brought up something else too, that's funny, but kind of interesting, and like you were alluding to it. We get these people, especially, not always, but especially if it's the first time in treatment, and they come to us for 7 to 10 days, and they come in broken, gift of desperation. I'll do anything. I'll go to any length. I want to get better. And then, the parents or the wife or the kids, whoever brought the client in, saw this person at their absolute bottom. They come in ready to do anything, take suggestions, AKA go to further treatment, and then 3 or 4 days in, they look better. They sound better. They feel better. They're a little bit better, but they're not better, and it's so easy for them to, confuse a little bit of progress with being cured. And to your point, then they're resistant to treatment. And it's so hard. I try to get ahead of it when I can to tell the family members and sometimes even the client, like, you're going to feel better, you're going to look better, but you're not better yet. Like I'll never be better. I'm always working on it, but yeah, and when we do have people who come in, you're right. Once we have them in a contained environment where they are feeling a little bit better, and we can start working with people we like, know, and trust to get them to the next place, that's a much easier transition than somebody in a complete panic Googling from their car while they're driving with the loved one sick in the front seat,
Yep.
Yeah. It's it's definitely an urgent situation, but I love that what you said. It is like waking up one day and realizing, oh my God, I got to go buy a car just out of nowhere, because it can be that expensive.
Absolutely. Absolutely. And that's, that was one of the first things I thought of when I came into the space was, it's a major financial investment and it just hits you.
Yep.
12 years ago, I tore my pec off my humerus. I was working out and blew that off, and that was awful. And my surgery was incredibly expensive, but I was able to wait a few months, let the swelling go down, do some prehabbing, some exercise beforehand, get myself ready for it. And then insurance covered it all, and it was all set and it was all easy. But our patients don't have that luxury, and it's a much more damaging and acute, a disease at that point versus just a muscle tear that'll still cost the same to the hospital. So yeah, it's interesting, and I think also from our industry, you mentioned you've been in for about 4 years. Over the last 10 years, I think we've seen a couple things that have been more detrimental. The patients have gotten by and large sicker. I think COVID, well, the stats and numbers I've seen showed that there's more co-occurring disorders, there's more co-occurring mental health because of the fentanyl increase. There's now a harder patient to detox, and there's more acuity to substance use side of things. And then similarly, insurance is paying less per day across the board. They're clawing back more. They're refusing to pay for some levels of care in some areas, and in some places they're refusing to pay at all. And so it is a wild dance that treatment centers have to play to stay in business, and still keep treating our patients who are not getting any more better. They're not getting it better because of what's going on. They're actually getting more difficult. And I think you throw on top of that, I saw a thing a couple years back, the state of Tennessee only graduated 8 psychiatrists one year. So there are only 8 actual psychiatrists graduated from Tennessee. And it's
Wow.
like, how do we staff all these treatment centers? And I think we all know medical directors who work in this space who might be a medical director of like 6 programs. So
Right.
everyone's spread incredibly thin, and it's really difficult. So I think we're facing a really unprecedented time for our space where it is on paper growing. There's more treatment centers popping up all over the place. There's more financial investment from different backers, but it's growing in a very belabored way where years ago it grew more organically and with the patient needs. So it's a very
Hmm.
weird time for our space. And back to that parent looking or loved one looking, without knowing that, I think that it's very difficult for them to find the place that has been tried and true or is new but founded by people who've been doing this for a long time. Or how do you navigate people who know what they're doing versus people who are one admit away from closing their doors and will just take anything in because they're afraid.
Right. Yeah. And operating from a place of fear is never good, no matter for, just overall, whether it's in our personal lives or work lives. Back to that point we were talking about, when you would, um, I was asking about, but the advice you'd give to families. What do you tell people who work at treatment centers about how to work with families? And I mean, without, making people feel comfortable, welcome in a state of total crisis, usually.
Yeah, that's I think that's where, we started this conversation off a lot about being in recovery versus not being in recovery. I think we see a lot of admissions centers, majority people in recovery. They maybe got sober at that program, became a tech, worked their way into admissions, and they have now all the empathy and knowledge of the treatment center, but might not have all the communication skills to really work with someone in that time of crisis. So some of my team members are exceptional. My team members here at Growth Sherpa are exceptional at motivational interviewing, working with the admissions teams to be able to, like I said, walk with the patients and their family members in need. But I've even gone as far as some programs I've worked with to set a clock that you can't talk about insurance for X number of minutes. And so you're going to have a conversation. I've seen that as high as 45 minutes at some places. I've had to implement just a 5 minute at some places I've worked with. We had to start small and work our way up. But I think it's a lot of that is just saying that, hey, we want you to put the person first. Remember where you were at when you're in that position, and ask them all the questions that you would ask a best friend. Hey, how you doing? What's going on? How can I help? What do you know about our treatment center? What do you need to know? Like where is this person at? Find out exactly where they're at with the process, and then be able to move from there. So I think it's a lot of that when we work with treatment centers on admissions is first listening to what they're doing, and then usually it's not major surgery. It's just a band-aid of saying, okay, you're doing a decent job because you do care about these people, but let's pivot your framework a little bit. And then, yeah, a lot of times, like I said earlier, we prescribe secret shopping. Let's call 10, 20 different treatment centers and see who does it well and write down what you like from what they did and write down what you felt bad about, like what made you in your heart feel weird about. And that is kind of an eye opener for many people who've maybe even been in our industry for years, but have never done that exercise.
Mm-hmm.
And remember, like that's the patient journey.
Yeah. And such a big part of it is just actually listening, listening, but also driving the conversation because when I don't get ahead of that, the next thing you know, the person's telling me, they're wasting their loved one's precious time when we could be helping them either get into treatment or help putting them in the right direction. So there's definitely a dance there. But that's really good intel. And I know I'm, probably guilty of just being too much of just a person in recovery on the phone and not enough of a person trying to do the actual job of getting somebody into treatment, whether it's with us or somebody else. But just trying to say, you know what? I mean, but it feels so good to be able to say, you know what? I've been there. I've been there, and I get to say that and mean it every day, So what else do you see about kind of changes in the industry, beyond the scary stats you cited about the only 8 psychiatrists in the state of Tennessee graduating, whatever year that was, but things like that. What are we looking towards, and what are bright spots on the horizon, and what is something to be looking out for not so great reasons?
Yeah, so I'd say on the challenges right now, nationally from outreach, because that's obviously what I specialized in. I can't talk much on the clinically side of things. Is we're seeing a big pivot from traveling for treatment to localized outreach. A lot of the larger, I mean, much larger systems nationally have gone to a model where you have a local sales leader, frontline sales leader, a few people in outreach, and it's a more community based approach. I think the challenge I have with this, I don't think that was bred out of benefit to the patients. I think that was bred out of lack of confidence in our space and a lack of training and education. So I think we as an industry are failing our patients there because we haven't put in the time and effort to train our outreach people to be able to have that conversation that we had earlier of how do you say, why is it better to travel for treatment? Because the better program is here, the more specialized program is there. So I think from a standpoint of industry wide meeting the needs of patients, that one is one of those things where we could do better. I think we could understand better where our programs fit nationally and provide outreach. The nice thing is now that Zoom is very normalized, it doesn't take actually a lot of travel anymore to do that. If you're an outreach rep, let's say in Central Georgia, and you have a very unique program there that people in Oklahoma need to know about, you can get on the phone, set up Zooms, and you can build relationships without ever having to hop on an airplane. So I think that's a huge benefit that we have now that people are more accustomed to that wasn't there 5 years ago when I was hopping on airplanes and traveling all over the place. So that's a huge win for outreach that I don't think is being utilized well enough, but can be. Um, I think other trends that are positive, positive or negative, however you want to put it. I think what we're seeing is insurance wanting to push patients through the inpatient side of things faster and more into outpatient. So we're seeing a lot more outpatient programs step up. Um, I've always said though, all things equal, the longer the level, the longer of treatment, the better. So as long as everything is equal, the longer stay in care, the better the outcomes are going to be. So perhaps this is actually one of those hitting blessings that we're going to see nationally as more partial hospitalization programs, intensive outpatient programs with housing open up and grow. Is that we find that clinical model that can integrate people faster in their early recovery versus, the inpatient 28-day model that we've known for so long. So I've seen more of that nationally. I'm trying to think if there's anything else that's popped up that we've really
Yeah.
seen. I don't think there's a ton.
Yeah, this seems to be a big push for outpatient, and it's almost like if the insurance had their way, it's kind of insurance carriers have their way. It's go to outpatient. If that doesn't work, then we can try something else. But I'm I just I was just a good old fashioned 28-day guy. But I was I was done in the middle, as they say. Yeah. So you said something a second ago that just I'm very good at making it all about me. So I wanted to mention the Zoom Teams part. So when I started in the field almost exactly 4 years ago, it was the height. I mean, COVID was had been in our lives for 3 or 4 months. So when I did travel, there was nobody on the road. There was nobody at the airports, and the flights I took, which were few and far between. And I wasn't really, conferences didn't even exist. So I spent about a year in the field where there were no conferences, very minimal air travel, and just travel in general. I mean, when I would go to hotels, there were usually not many people there, and everybody was, totally freaked out and masked up, and Lysol stickers that would show that the door to the hotel room hadn't been open yet, all that. So I kind of had the benefit of that. Was the only thing I knew for a year. And so to your point about, the sort of lack of the necessity for constant travel, which is really a good thing, because traveling by air is a complete nightmare right now anyway. I have a bad experience about 99% of the time. So I'm kind of happy to not do that. But what I kind of think is necessary is to be able to go see a lot of people at one place, like a conference, and then go really hit the team Zoom. And that way we don't have to travel every second just to go see, one or two treatment centers a day, maybe in a city where there are multiple. But yeah, just kind of get to know some people, then go have some meetings. And then, but I will say, I think that from my end, I respect, especially interventionists who want to see the place before they refer. I totally get that. So, I'm always open to and trying to have people come see us. And I think, most detoxes aren't going to really advertise people to come tour, families and intervention stuff. We welcome that.
Yeah, we'll say that's it's a really good point. Is one thing I do miss from the before times prior to COVID was the professionals weekends that treatment centers would put on. I think were an absolutely fantastic way to showcase your program to people who need to. Um, all the previous programs I worked at pre-COVID, we would do some form of it where, uh, like you said, interventionists, ed consultants, clinical directors, medical directors, top personnel from all your partners from across the country could come in and really get to know your clinical staff, your medical staff, your leadership team, your outreach team, your admissions team. Um, that's something that we haven't seen much come back. And if any treatment center leadership's out there listening, that's one of the things that I would say. If you don't have that planned over the next 6 months, you should plan one. 100%. They don't cost too much, but from the value that you get from those deeper relationships. I remember, sorry, I had an account actually out of Raleigh go out to a professionals weekend in Memphis one time, and this account in their personal life had a lot going on and was sitting there overlooking, I believe is the river there, and had a beautiful dinner, and they're staying at this nice hotel. The hotel has like the ducts that goes down the elevator now at
Yeah. Yeah.
Peabody.
That's Peabody. Yep.
Yeah. Yeah. And so just really taking it all in while they're going through this difficult time. And the CEO of that treatment center walks up and sits down, and they get a deep conversation for hours and about life and, just what's going on and who they are. And, just an incredible experience. They got to bond over that you can't get on Zoom. And we've kind of lost a lot of that in our space. That's kind of an important point. Zoom, I think, can provide the outreach, but doesn't provide the person, the soul,
No,
of it.
totally.
And
It's
that's
funny you say that too, because our first podcast guest earlier was somebody I met at a professionals weekend. One of only a handful I've been to, because like you said, they just are kind of slowly trickling back. But I do think that they are great, because it's usually a small, maybe 15 to 25 people, something like that. And everybody gets to know each other in that short, because conferences are great too. It's like buckshot. You see a million people, some you're going to end up like having dinner, playing golf with, and get to know better than others. But those professional weekends are great. And usually there's like some kind of activity. I mean, we did this glow in the dark kayak trip in Pensacola last fall with a bunch of people and got to know them. And, you can't, right. I mean, it's priceless to be able to actually hang out with somebody and get to know them. I mean, being on a Zoom is okay. This person is, nice and they know what they're talking about, but you don't quite get to know them. You're right.
Yeah, conferences are great. So that's the one pushback I get from a lot of the CEOs I've worked with, both as an internal employee and as a consultant, is the phrase, I don't think conferences are worth it. I don't see the ROI. I don't think they're benefit. And I would tell anyone, and I hope I hurt feelings on this, is if it's not worth it, you're not doing it right. So conferences, yeah, it can be expensive for sure, but without preparation, without figuring out your game plan, looking who's going to be attending, setting up meetings beforehand, doing good follow up, yeah, they're absolutely not worth it. But when you do those things, you can have such an effective time. I never forget one of the first conferences I ever went to. The very last meeting I had with my suitcase in hand, about to fly back from the Breakers in West Palm, I have a 30-minute meeting with a treatment center that just pulled me aside and said, "Hey, I've been trying to meet with you. Can you meet real quick?" Absolutely. So we had that meeting. I think I did the math. Over the next 4 years, they sent about $800,000 worth of business to the treatment centers I worked with. For a 30-minute meeting at a conference that costs money, but didn't cost $800,000. So,
Exactly.
absolutely. And then I think for anyone who's not in the space, who sees or is in the space, maybe not in outreach or admissions, and says, why are these marketers, why are these outreach people doing these things? Um, yeah, they're absolutely fun, but when you can be that inner 8-year-old with other grown-ups and do these things like going on rides at Disney or kayaking and things like that, like putt putt and bowling, like you tend to break down and remember to put the patient first, put your self care first. All of a sudden, you start doing things for the right reason versus sitting at your computer all day staring at Salesforce and going, "I'm behind goal. I'm behind goal." Like
Right.
different frame mindset that helps you be a little more successful and just better adjusted too.
Yeah. And I mean, and this is not an easy job. It's not, and nobody got into it to get rich. I mean, it's hard work, and it's a lot of nights and weekends, and I mean, that's not even talking about the phone ringing all the time. I'm talking about actual work obligations. Some of them are dinners that go late. I mean, these conferences often are all through a weekend, and nobody is saying, "Oh, well, hey, Steve, I know you're going to be at this conference this weekend, so why don't you take Monday and Tuesday off since you don't have a weekend?" Because it can easily be looked at as, "Oh, it's in Florida," but we're definitely working at these things, and we're away from home, we're away from families, we're away from friends, we're away from our routine.
Oh
So
yeah.
yeah,
One conference a couple years ago was the golf tournament that we were sponsoring started November 1st at 8 a.m. There were no flights out of Charlotte to that area after 6 p.m. on October 31st, and I'm not going to miss my kids trick or treating. So I drove in the middle of the night all the way down there, 2 hours of sleep right at the golf tournament. And yeah, on LinkedIn, it's going to look great that I'm out golfing with people
right.
and in Florida, but inside, my adrenaline was the only thing keeping me going. That and like 3 Red Bulls, and it looked better than what it actually was at the
Right.
time. But yeah,
Yeah.
that's part of it. I mean, I always say Arthur Miller didn't write Death of Supply Chain Manager. He wrote Death of the Salesman for a reason. So
That's I love it. That's a great point.
yeah.
Well, what do you, this is a good place to wrap it. What, any final thoughts? Well, how can we find you and kind of recap what you do? Because what you do is very interesting and you work with a lot of great people. And I know you also, one thing I want to mention is Steve, is the administrator of the North Carolina Professionals Liaison, email serve, which is a listserv which helps everybody in our field all the time, every day, all day. People are constantly going back and forth. So thank you for your service there.
Yeah, so do a few things. So, like you said, the North Carolina PLA listserv that was founded 10 years ago as a way of connecting treatment professionals across the state of North Carolina to basically be a resource for each other for everything from open houses to treatment placement to just networking in general. We're hoping to build a website for it with message boards, job boards, shared calendars for events, everything. There is a GoFundMe started for that right now. We still have quite a ways to go, but hopefully we'll get that to its goal here in the next couple months, and we can then have an enhanced PLA. What I love about our PLA too is it's very egalitarian. I don't own it; I just oversee it. The community owns it. And so what was the coolest thing for me was a few years back when people started organizing PLA events on their own. That was awesome to see. That's exactly the intent for this organization, was to help the community grow the community and enhance the way we communicate and work with each other. So really cool to see that. And then Growth Sherpa Consulting. So you can find me on LinkedIn and Growth Sherpa Consulting. Our website will also be live here probably within a week at growthsherpaconsulting.com. Up until now, we haven't needed one. So now we're finally doing one because we do marketing consulting as well. So essentially, what we do is we create bespoke plans for treatment centers to help them achieve their census revenue goals. We work from everything from admissions, outreach, marketing, and also vendor and operation management. So we basically will help dissect every little piece of the pie from the front end, making sure that they're all working in a very harmonious ecosystem, and then basically design the solution based on the treatment center. So no two treatment centers are the same. No two treatment centers have the same revenue or staffing or geographical or whatever problems, but every treatment center can benefit from a more unified approach to patient acquisition. So that's what we create, and it's based basically just on that. So what I think we're doing is really unique. It provides essentially a chief marketing officer, a VP of admissions, a VP of marketing, and outreach director, all in one nice, neat little bundle. And so we have been doing that now for about 8 weeks in this new model. Growth Sherpa has been around for a little over a year, but this new model has been 2 months in the making and being really well accepted. So looking forward to working with more programs to help them be more effective at getting patients in the door, more predictable, more scalable, and ultimately give them the opportunity to grow.
Awesome. Thank you, Steve. Steve's an amazing guy. He's done a lot to help me in the companies I've worked with, either directly or indirectly. And we just want to thank him for his time today. And we will see you out there in real life soon. Thank you, Steve.
Yes, sir. Thanks, B. Talk to you.